there are so many poisonings occur, and one of the big ones is that because it's addressing the immune system and making it healthy, it will help dramatically in food intolerances and allergies. Now, some allergies are normal, in certain times of the year. Having a runny nose because of certain pollination occurring in the oak trees is fairly normal. But when it's excessive and when it lasts for a long time and you get very ill, that's a different ballgame. That means the immune system is overreacting. And again, this body chemistry treatment is designed to stop that overreaction. And the same way if the person is allergic to certain foods, we're finding that in most cases, just a simple access treatment use of body chemistry can help that allergy and clear it up. If it's a very severe case, such as like peanut allergies giving anaphylactic shock, very often the access level of our BodyTalk is not strong enough. And in that case, the person would need to go to an advanced BodyTalk practitioner who has many other tools they can use to overcome that, because we do get very, very good results with severe cases of anaphylactic shock from peanut allergies to peanuts and other substances and foods. So body chemistry, very, very important. So as you can see by now, by the time we've got the brain functioning and we've balanced out the switching and we've got the body hydrated and functioning right there, and we've got the immune system functioning, that's going to cover a lot of territory and a lot of diseases. Sure, it doesn't cover some of the really serious ones. If I have a car accident, you're still going to have to go to hospital and see a surgeon. And if you have a heart attack, you need a surgeon to replace some valves or arteries, etc. And we're still going to need drugs for certain conditions and so on. But what I'm getting at is we can do so much for ourselves safely. The final technique in BodyTalk is it's a simple technique that is designed where we touch various parts of the body and do this tapping process that is designed to balance out the posture of the body. And when you balance out the posture and you get the muscle balance right and the ligament balances and everything like that right, you're going to improve the structure of the spine, the posture and the structure of the joints and so on. And this is going to be very, very powerful for treating back conditions and treating musculoskeletal type conditions, because very often, build up of arthritis in the knees and everything is because the posture is right out of balance and you're wearing out the joints because you're just not walking in the right way. And by balancing all that out, we can make a huge improvement, particularly if it's done in a preventative basis, where you're treating children through the formative years to keep their posture sound, so as they get older, they're going to have a properly functioning body. And another aspect of this technique, what we call the reciprocal technique of access, is we can use it for first aid, because we have a way of simply, if someone injures, say, their elbow badly, by holding what we call the reciprocal, which is the knee on the opposite side, and again doing our famous tapping process we do in BodyTalk, we can actually accelerate the repair of that injury if it's a bad sprain or something like that. And we can use it for burns and cuts and contusions, and it can be very, very dramatic. We've got such wonderful cases. I think one of the most common one we get is the children who get the finger caught in the door and door is slammed and their thumb's still in there, and they bring it out, and under the access system, by simply letting the kid hold their thumb because it's hurting like hell, and us holding the reciprocal, which is the big toe on the opposite side, and doing a tapping process, literally within minutes the pain starts going very quickly. Within 10 or so 15 minutes the kid's really not in much pain at all, and by the next day there's absolutely no sign whatsoever of the injury, when normally that would be black and blue the next day. So the repair can be really spectacular. And that type of work is what we call fast aid in access. And it's so very useful for simple day-to-day things that occur. Once it gets serious, once you start breaking bones and things like that, yes, then you've got to go to the doctor or the hospital and have all the appropriate work done. But in the meantime, we can do so much. So what does this mean? It means that access is going to give us access to a very simple system that can be learned in one day for very low cost, and can be utilized by members of a family or a community, right? And used on those people in a non-professional way. We tend to call this our non-professional courses for self-help. Although if you're a community member, it may be that you're getting paid to look after that community in that way. It is not a substitute for full medicine. It is not a substitute for the treating of serious conditions with drugs and surgery and all the other techniques. But what it does mean is we can start being proactive about empowering ourselves to take care of all the little stuff, the time-consuming stuff. And also, by using the technique regularly, instead of just waiting for us to get sick, but by using it, by treating each other with this technique, say, once every week, then what we're going to do is gradually re-establish healthier pathways in the brain, reduce the stress levels in the brain, strengthen the immune system, improve the posture. We're going to gradually improve our total health, which means that we're going to ultimately need our access less and less, because we're going to have a higher resistance to disease, a higher resistance to stress levels, less of a tendency to switch or to blow our circuits as far as the brain goes and things like that. So it's a way of maintaining health. Sure, exercise is great, good diet is great, there's no substitute for that. But you know what? Getting the wiring right, getting the brain to function right, getting the immune system to be triggered right, reducing the total stress levels of the brain and of the whole body, they're critical factors. They're something we have to do. And we can do them ourselves in an effective way, not just numb them by taking Prozac or something like that. You know, those things are trying to reduce stress chemically, but they're not really establishing and re-establishing healthy immune systems or healthy brain function. They're basically just deadening our system so that we don't care that we feel lousy. Okay? So let's start doing something really proactive about this. Access is a brilliant way to get involved in BodyTalk. You don't have to become a practitioner. You don't have to study for ages. You can do it in a day. And of course, to me, it's for everybody. Every family, anywhere in the world, should have at least someone in that family with access. And of course, as you may be aware, we part of the BodyTalk system, we have the International BodyTalk Foundation, where we have a program where we have instructors that are going into third world countries and teaching villages in there. And of course, it's very different in those situations because they can't afford to pay. Some of those villages make $5 a month or $5 a year sometimes. So we have people that are going in there and we're teaching the members of the community in the villages for free. And this is our community outreach work that we're doing through our not-for-profit foundation, the International BodyTalk Foundation. And that to us is a very, very important part of our mission statement in BodyTalk. And for my wife and Esther and I, it's a very major part of how we spend our time. And certainly we invite you to learn Access yourself, but we certainly invite you to go onto our International BodyTalk Foundation website, which will be right there somewhere on that page where you can click to get onto it, hear about that, and consider making some donations towards it. This very, very good work that we're doing there. Because again, it's not charity work, we're actually teaching people how to look after themselves. We're making a difference in community by making them proactive in looking after themselves and taking more responsibility for their short-term and long-term health. And you can make a huge difference because, you know, a simple donation of $100 can actually pay for a whole course, for a whole community, a whole village that can be helping everyone in that village for the rest of their lives. And it can make such a difference. And we really encourage you to be involved with that. But in the meantime, look into Access further. Go on our website, see where there's an Access program going nearby, and I really strongly urge you to go along and learn it. It's a lot of fun to learn, it's very easy to learn, the techniques are ultra simple, and you will just simply have an enjoyable day that will set you up for the rest of your life. Thank you for listening.